Thank you. Thank you, Mr. Chairman and Senator Sear. And I want to thank this committee for hearing our stories and facts about this class of medication. I want to make a point of saying that I'm not against these drugs. I'm for the responsible use of them. I want to look at some of the facts that we've gone over these past years and things. Dr. Charles Whitfield, in his book, Not Crazy, You May Not Be Mentally Ill, states, benzodiazepines have one of the most debilitating withdrawal reactions in all of medicine. In 1961, in the Journal of American Medicine, Dr. James Whitelaw's article, Menstrual Irregularities Associated with the Use of Librium, wrote about the effects benzodiazepines have on a woman's menstrual cycle. First year we were here, just about every woman who testified had either a DNC, menstrual cycle, or had a hysterectomy. Yet young girls of childbearing age are still being given this class of medication. I had an unnecessary hysterectomy at 41. If you Google benzodiazepines and dementia, many articles, 3 by Harvard Health Publishing from Harvard Medical School. Can you imagine what happens to somebody in their 20s or 30s who went into their doctor with a minor issue, 20 to 40 years later are having symptoms of dementia and must now suffer horrific withdrawals trying to get off this medication? 60% of all opioid-related deaths involved a benzodiazepine. My own niece died from this combination taken as prescribed at age. There have now been 2 symposiums on benzodiazepines, television specialists, documentaries, organizations set up, 20 books written by survivors, books written by medical professionals, numerous online support groups to help those suffering. Other countries have organizations where you can help, and we still have nothing in the 25 years I've been advocating for. Since we were first here in 2016, becoming more and more known about the horrible withdrawals and the long-term suffering of benzodiazepines. People are walking into their doctor's offices to a sign stating they are no longer prescribing benzodiazepines. People are being cut off cold turkey. In 1979, when Senator Ted Kennedy led hearings on legislative reform for benzodiazepines, no policy change occurred. Can you imagine if we're trying to do what we're doing today happened back then? Many wouldn't have been had to live on disability. Many would have been able to continue with their careers. Many wouldn't have had their marriages dissolved or their children walk away from them, and then many wouldn't have had their retirement cut down to nothing. Many would have been saved from the suffering they've gone through. Those that have killed themselves because their withdrawal was so brutal and never ending. Now their families continue with the suffering of missing loved ones. None of us are here today speaking for ourselves. We are speaking on behalf of those coming after us. This truly is an iatrogenic illness, doctor drug induced, and each one of us here testifying has been harmed. None of us were warned of the potential dangers of this class of medication. And I'm sure any doctor that testifies against this bill knows that there are problems with the lack of information with these drugs. They themselves are not fully educated. This bill can save lives. Thank you.
Thanks.